Craniosynostosis is a birth defect affecting the skulls of newborns and infants. A newborn skull is made up of 7 major bones called the bony plates. These bones do not fuse together until the age of 2. When an individual goes through infancy, these bones join together after brain growth is complete. If an infant suffers from craniosynostosis, one or more of the joints between bony plates close prematurely before an infant's brain is fully formed, hindering brain growth. But why is brain growth so important? Dr. Daniel Dickinson explains that the brain
controls of our breathing function, our heart function, all of our muscles, digestive tract, and all those things are controlled by different centers in the brain. And so the brain really, the most important part of the body, it controls all of the functions we need to live every day.
With the bones of the skull constricting brain growth, these bodily functions would not be possible. But where do these bones form? The bones form at the sutures. Sutures are a type of joint between the bones of the skull where the bones are held tightly together by fibrous tissue. This fusion can happen before the baby is born, but most frequently happens in the first year of life. After 2 or 3 years of age, it is very unlikely to develop. Craniosynostosis is considered rare. It affects approximately 1 in 2,000 to 2,500 people in the general population. Symptoms of craniosynostosis include a misshapen skull, a disappearing soft spot or abnormal feeling of the infant's skull, slow or no growth of the skull as the baby ages, intracranial pressure, or the development of a raised, hard ridge along select sutures. Intracranial pressure itself, if untreated, can have serious effects such as blindness, seizures, brain damage, or even death. Facial deformities may cause permanent head deformity, poor self-esteem, problems with speech and language development, and upper airway problems resulting in trouble breathing. Craniosynostosis can either be classified as syndromic or non-syndromic. There is no known cause for non-syndromic craniosynostosis, the most common type. However, syndromic craniosynostosis is caused by specific genetic syndromes. These syndromes can include Apert syndrome, Crouzon syndrome, and all syndromes that affect skull development in infants. A baby can be diagnosed through a physical exam, imaging studies, or genetic testing. A physical exam includes the doctor examining the infant's skull for abnormalities like protruding ridges or facial deformities. Imaging studies may involve a CT scan of the skull to see where the sutures may have fused, or an X-ray may be used to measure the dimensions of the skull. Genetic testing will be done if the suspected cause for craniosynostosis is syndromic. The testing can identify what type of syndrome the baby is suffering from. Genetic testing may require blood, hair, skin tissue, other tissue, or cells from inside the cheek. There are 5 possible types of craniosynostosis that an infant can be diagnosed with. These types of craniosynostosis are determined on what sutures are affected. The 3 most common types are sagittal synostosis, coronal synostosis, and bicoronal synostosis. Other types of craniosynostosis are metopic synostosis and lambdoid synostosis. The most common type of craniosynostosis is sagittal synostosis. It affects the suture at the top of the head, or the sagittal suture. This causes the skull to grow long and narrow rather than wide. Coronal synostosis refers to the premature fusion of the coronal suture. The coronal suture is one of the sutures that runs from each ear to the sagittal suture, the one on top of the head. This forces the head to flatten on the affected side and possibly raise the eye socket and cause a deviated nose and slanted skull. Bicoronal synostosis is the fusion of both of the coronal sutures. This may cause a flat, elevated brow. Metopic synostosis is the fusion of the metopic suture that connects to the sagittal suture on top of the head. This fusion may cause the scalp of the infant to have a triangular look. Lambdoid synostosis is the most rare form of craniosynostosis and is the premature fusion of the lambdoid suture which runs across the back of the skull. This may cause flattening of the head on the affected side. Mild cases of craniosynostosis that involve the abnormality of one suture and are non-syndromic may be treated by a helmet to reshape the head and allow room for brain growth. However, the most common form of treatment is surgery. Surgery will relieve pressure on the brain, create room for the brain to grow normally, and improve the baby's appearance. There are two types of surgery. The type is chosen depending on the type of craniosynostosis and whether or not there is an underlying syndrome. Two surgeons will perform the procedure on the baby: a neurosurgeon, a surgeon that specializes in brain surgery, and a craniofacial surgeon, a specialist in the head and face. Traditional surgery involves an incision on the infant's scalp and cranial bones. The surgeon will then proceed to reshape the affected part of the skull. If needed, plates and screws may be implanted into the skull to maintain shape. Surgery will take hours and the baby may be released from the hospital after at least 3 days. More surgery may be required to treat facial deformities or recurrent craniosynostosis. Endoscopic surgery is a less invasive surgery. However, it isn't always an option. In this procedure, the surgeon uses a lightened tube or an endoscope to open the suture to allow brain growth. The endoscope is inserted into a small scalp incision over the compromised suture. Because this is less invasive, the surgery only lasts about 1 hour. Therefore, the patient may return home after a day. Follow-up visits may be required if the baby's craniosynostosis is syndromic. In the appointments, the doctor will monitor head growth and intracranial pressure. Hannah McKay had sagittal craniosynostosis. She had surgery to treat the craniosynostosis at the age of 6 months. Here, she tells her story.
My name's Hannah McKay, and I had, what's it called?
It's hard to say. Craniosynostosis.
Craniosynostosis. And my mom, when she was brushing out my hair when I was a baby, she noticed that, I didn't have a soft spot. And when she took me for my physical, she told our doctor, and the doctor said I had it. And that if I didn't have the surgery when I was 6 months, my brain would keep on growing. And if I didn't have the surgery, my skull would have been an inch out over my eyes. So, that's me.
That's you. How old were you when you had the surgery?
I was 6 months.
You were 6 months old. And do you have a scar from it?
Yeah, I have a scar that goes right here.
Okay.
And I got about 230 stitches.
230 stitches. And did you have to go for appointments after?
I don't know exactly.
Okay.
But I think so.
You think so? Good. Do you like your scar?
Yeah, because I feel like I can intimidate people. Because if they mess with me, I can just tell them, guess what? I have scars from surgery, so watch out.
Exactly. Thank you, Hannah.
No problem. My name's Hannah McKay, and I had, what's it called?
It's hard to say. Craniosynostosis.
Craniosynostosis. And my mom, when she was brushing out my hair when I was a baby, she noticed that I didn't have a soft spot. And when she took me for my physical, she told our doctor, and the doctor said I had it, and that if I didn't have the surgery when I was 6 months, my brain would keep on growing, and if I didn't have the surgery, my skull would have been an inch out over my eyes. So that's me.
That's you. How old were you when you had the surgery?
I was 6 months.
You were 6 months old. And do you have a scar from it?
Yeah, I have a scar that goes right here to here.
Okay.
And I got about 230 stitches.
230 stitches. And did you have to go for appointments after?
I don't know exactly.
Okay.
But I think so.
You think so? Good. Do you like your scar?
Yeah, because I feel like I can intimidate people. Because if they mess with me, I can just tell them, guess what? I have scars from surgery, so watch out.
Exactly. Thank you, Hannah.
No problem.